CNAs help clients meet their nutritional and fluid needs as they assist them with their activities of daily living. Let's begin by reviewing the anatomy and physiology of the gastrointestinal system. The gastrointestinal system, also referred to as the digestive system, is responsible for several functions, including digestion, absorption, and immune response. Digestion begins at the mouth, where chewing of food occurs. This is called mechanical digestion. If food is not broken down mechanically by the teeth, it is very difficult to digest, and it also increases the risk of choking. If there are any concerns with missing or broken teeth, dentures that don't fit well, or any pain or open areas in the mouth, the NA should report these concerns to the nurse immediately. After food is chewed and swallowed, it goes into the stomach via the esophagus. Involuntary movement, called peristalsis, allows the food to enter the stomach to mix with acidic gastric juices. The breaking down of food with these acids is called chemical digestion. From the stomach, the liquid food, called chyme, passes through the small and large intestine, where nutrients and water are absorbed into the bloodstream. Waste products are condensed into feces and excreted through the anus. More information on the structure and function of the digestive system will be covered in later modules. Appropriate food and fluid intake are essential to good health, so anything that potentially decreases a client's appetite must be addressed. For example, all 5 senses decline in functioning to some extent in older adults. It is important for the NA to provide accommodations that address these declines in sensory function that can impact food intake and overall health. Enhancing food intake in older adults with altered sensory function includes the following accommodations. If the resident is known to wear glasses, ensure they are wearing them and the lenses are clean. Seeing food often stimulates the desire to eat. Explain what is on the meal tray if the client has significant visual impairment. It is helpful to use the clock method, such as, on your plate, your peas are at 3 o'clock, your roast beef is at 6 o'clock, and your mashed potatoes are at 9 o'clock. If a resident has a pureed diet order, review their menu so you can describe each type of food in an appealing manner. Make meals look as attractive as possible. Take food off trays and avoid using plastic utensils and disposable cups whenever possible so the resident feels as if they are having a meal at home. Hearing. If the resident has hearing aids, ensure they are in place, charged, and functioning so they can hear you describe the food. Ask if music is preferred during mealtime. When seating residents in a public eating area, ensure they are seated with others with similar cognitive status so they may enjoy conversation while eating. Touch. Encourage the resident to eat as independently as possible by using adaptive silverware or other meal aids. Occupational therapists can assess the needs of the resident and provide adaptive equipment. If utensils can't be held by the resident, try using finger foods such as fruit, bread, or crackers. Smell. If possible, dietary staff should prepare meals near resident rooms because the aroma of cooking food may increase hunger. If a client is eating a meal in their room, clear the room of unpleasant odors or sights. For example, empty the trash can if it has soiled incontinence products, and empty urinals that may be sitting on side tables. Taste. Check the diet order. If the order permits, ask residents if they prefer seasoning or condiments. Ensure hot foods are served hot and cold foods are served cold. Judge the temperature of the food by placing your hand above the food to sense heat, but do not touch the food directly with your hand. Rewarm hot foods that have cooled. If the resident does not like the meal choice, Find an alternative food that appeals to them.